Mr Deputy Speaker, and thank you to all honourable members who've contributed today. I particularly obviously want to thank my honourable friend, the member for Wellingborough. I can't believe this is the first private member's bill that he's got to third reading, as he's done so many. But I'm delighted to have collaborated with him to achieve this. That's quite an achievement. He was typically generous in his comments about me, which are completely undeserved, because he's quite right when he says that the thanks need to go to the honourable member, the member for Bury St Edmunds, who is really the inspiration behind this bill. And I just want to very briefly just set out exactly why the government views this bill as a very important measure, and why we are very keen to see this progress to put the National Data Guardian onto a statutory footing. So the government is committed to ensuring that the health and adult social care system in England realises the full benefits of sharing health and care data in a safe, secure and legal way. And we've talked a lot today about the benefits of such data sharing. But of course, if data and information is to be used effectively to support better health and care outcomes, it is absolutely essential that the public has trust and confidence that there are strong safeguards in place to protect it from inappropriate use. And that's really the ethos behind the establishment of the National Data Guardian. The Data Guardian is an independent, authoritative voice for individuals in how data should be used. And at the heart of this really defines the relationship between the health providers and individuals, maintaining an appropriate balance between safeguarding and privacy, and again underlining the very serious principle of informed consent by patients. To clarify the scope, the National Data Guardian's remit covers all health and adult social care data, which is defined in the bill as essentially the same as patient information in section 251 of the NHS Act 2006. That basically enables the National Data Guardian to influence anything that impacts on the processing of health and adult social care data held by all organisations that are listed in this bill. So this will actually enable the promotion of good challenge and good building of insurance across the health and care system, and enable the system to access the data it needs to run safely, effectively and efficiently. I really can't emphasise enough the fact that the voice of the patient and the service user is really the paramount principle under which the National Data Guardian will operate, notwithstanding the fact that she's working through the use of guidance to providers. It is basically taking the position of what is in the best interest of the patient. And in so doing, we hope that the guidance she issues will really establish confidence on the part of the public that their data is being used effectively. Much has already been said today about the role of Dame Fiona Caldecott, who is the first National Data Guardian for health and care. She's been described variously as phenomenal, energetic and influential, but I think I'd like to take this opportunity to recognise the enormous contribution that she's made, and I'm sure she will take full advantage of the statutory powers that will follow once we put this bill onto the statute book. But I'm delighted actually to have the support of the benches opposite in this, because it does actually recognise that we do realise that to secure the best possible health treatment for all patients, use of data sharing is indeed essential. And I wanted to just address the particular points that the honourable gentleman made in his comments, and his desire that the Data Guardian really will have teeth. Again, I emphasise the point that she will be acting in the interest of patients, and that will mean challenging providers, where, as we all know, some providers are instinctively cautious and defensive about data sharing. And I think that real challenge from a patient's perspective means that patients can be sure by her advocacy that it's the right thing to do. But also there's no escape for health professionals and providers. She will, as he said, she'll be using her powers by issuing guidance, and there will be clear expectations that everyone will abide by that guidance. But in respect of real teeth, I think we see this as one of changing organisational behaviour rather than having rules. And I think the fact that she will be producing an annual report on how she is discharging her obligations and how the health sector is reacting to it, I think will be a very powerful tool, because I think we often find that transparency can be much more effective than actually rules and regulations and laws in many respects, because once you highlight behaviour that clearly is not delivering the outcomes that we intend by legislation, that public embarrassment, I think, is much more effective than many other tools that we have at our disposal. And frankly, I think many people, and it's heartening to see the interest in the Chamber on this bill. And we've heard some individual examples of poor practice. I'm sure we'll have plenty where anyone is not abiding by Dame Fiona's advice. So we do expect the National Guardian to use her annual report and use that to implement further guidance. We fully expect that the duty for health and adult social care organisations and providers to have regard to that guidance will also be taken into account by the Care Quality Commission and by the Information Commissioner's Office. So it's not just us and the Data Guardian that can hold them to account. But I say it's really an issue of expecting serious change in behaviour that we are really taking this forward. In addition, the National Guardian, Data Guardian will look at their own operating approaches to see what more it can be done to actually make sure they have teeth. And again, that's part of the reason why we are putting this on the statutory footing. The fact that her advice then has legal clout means it will have much more teeth. She will have the day-to-day communications mechanisms at her disposal, again, to highlight areas of good and poor practice. And, of course, the statutory duty to consult people they consider appropriate before publishing guidance, which, again, will fuel an important debate about behaviour in this area. Now, I know I'm very short of time, so I just want to address some of the issues that have come up in the debate, not just here today, this afternoon, but also at a committee stage. I know various concerns have been expressed as to why children's social care data is not covered within the remit of this bill. And I'd just like to explain the reasoning behind this and why actually we don't consider that's a weakness. Clearly, data relating to children's social care has its own safeguards and protections. They do operate within a different legal framework to adult health and social care. These safeguards and protections are governed by their own statutory guidance, and we wouldn't want to put in anything that would conflict what are established guidelines. The context and imperative for using and sharing data set to safeguard children is also different, where the most important consideration is whether sharing information is likely to safeguard and protect a child. And I think that's a really important point, because there the issues regarding safeguarding trump those regarding privacy and personal ownership. So rather than extending the National Data Guardian's role to cover children's social care data, our view is that action should remain targeted elsewhere on improving timely and proportionate information sharing to keep children safe. So where we are is that the officials in the Department for Education and the Department for Health and Social Care have reached a sensible interpretation of the bill, and this would not preclude the National Data Guardian from engaging constructively with the Department for Education on adult social care data and its interaction with children's social care data. There's been an exchange of letters between the departments to formalise that agreement. And in respect of safeguarding children, the powers in the Children's Social Work Bill are the mechanism for Department of Health and Department for Education to act and to share information. We've also been working across government to introduce an amendment to the Data Protection Bill, which sees safeguarding brought in as a condition by which information can be shared without consent to keep children safe. We will continue to work with local authorities to consider and monitor the impacts of the National Data Guardian in this space, so where it would be appropriate to work outside of the remit of the statutory powers set out in this bill in a way that's consistent with the law and regulations as it currently applies to data sharing for children that we currently have. And that's something we should keep a watching brief on. But I think at this stage we should not do anything to disrupt what are established obligations, and where with sensible discussion between the National Data Guardian, the DfE and the Department of Health, we can actually establish good practice in this area. And this is entirely consistent with how we coordinate the respective obligations of children's social care and adult social care services. I've got very little time. I just wanted to touch on one or two other issues before concluding. There was a brief discussion earlier about the territorial extent of the bill. I can clarify it does only apply to England. It is a technicality that it applies to England and Wales on the basis of how we approach legislation in this place, but it does only extend to England. I can also clarify that public health data is included within the remit of this bill, so that will also be shared. And we also would like to affirm that the bill covers local authorities where they are actioning services in regard to adult social care and, of course, public health. So I'd like to just conclude by confirming again the Government's commitment to this bill and our desire to see it succeed. I'm confident the bill will achieve the aims the Honourable Gentleman has set out, and I think that all members have set out in their support for the bill. And I hope that after today's important stages, the bill will make swift progress so that it can proceed to royal assent at the earliest possible time.